this is 80-year-old post-COVID patient. All right. So this is, you can see here, the correct answer is multifocal atrial tachycardia. Okay. You can see there is a narrow complex tachycardia. Okay. And then, why this multifocal atrial tachycardia? Because you can see there is more than more than three morphology of P wave. So this is not atrial fibrillation. So this is one of the differential of irregularly beat. So not all irregular beat is atrial fibrillation. So this is very clear cut. You can see here, this is, you can see very obvious P wave here. But this P wave, first beat and second beat is different. And the third beat also different. So you got multiple, and you can see here, multiple beats are different. So this is multifocal atrial tachycardia. Don't mistakenly with diagnosed as atrial fibrillation. Next, 56-year-old with shortness of breath. So the correct answer would be AIVR here. So what are the features in this ECG? There is prolonged QRS complex, and it's broad QRS complex. But look at the rate. Look at the rate. The rate is not achy, all right? It's prolonged. It's broad QRS, but the rate is not achy. The rate is around 70 to 80 beats. And you can see here, this is normal sinus beat. So this is accelerated rhythm that come from ventricle. So it is accelerated because what is the accelerated? Because ventricular rhythm, we have the automaticity. If let's say the sinus node depressed, sinus node depressed, bradycardia, sinus node bradycardia, so the other pacemaker will automatically, we have escape beats. So in that here we can see escape beat from ventricle, but it is accelerated because of the rate is between 40 to 100. If you have more than 100, we call it as VT, ventricular tachycardia. But if the rate 20 to 40, we call it as a ventricular escape beat. Right. ECG number 3. This is young man, relatively middle age, presented with near syncope. You can see here, the correct answer will be pre-excited atrial fibrillation. So what are the features in the ECG? There is a broad complex tachycardia, all right, broad complex tachycardia, and it is irregular, all right, broad complex tachycardia, it is irregular. So this is pre-excited atrial fibrillation. In this patient with WPW, this is it is very dangerous. It can lead to ventricular fibrillation. So you must act very fast. You see this type of ECG in your center. ECG number 4, 19-year-old, come for medical checkup. There's no asymptomatic. This patient is asymptomatic. So what you can see here, look at the lead V5 or lead 2. You can see here QRS complex is a little bit different. Okay, the rate is normal. All right, look carefully. Every beat P followed by QRS, but this beat you can see here slurring, the QRS slurring. And look at the PR interval short here, and you can see delta wave. So this is WPW with intermittent pre-excitation. All right. Next, 72-year-old complain of recurrent giddiness. The correct answer will be isorhythmic AV dissociation. So look carefully. Look at the lead 2. Here you can see P wave followed by QRS, P wave followed by QRS. So one P wave followed by one QRS. But look at the P wave become here, it become dissociate. All right. So the sinus impulse is slow. So when the sinus impulse here is around 43 beat per minute, the sinus impulse. So what happens if your sinus impulse slow? The junctional will take over. So here, this beat junctional is escape beat. This is not a conducted beat from the P wave. So this is isorhythmic AV dissociation. This is different with complete heart block. All right, in complete heart block, you can see a multiple P wave. It is not conducted to the QRS. This one P wave, one QRS. But the P wave is too slow, the junctional take over. So For this ECG, correct answer will be isorhythmic AV dissociation. All right, pass over the mic to the